They don't let us out much.
Am I arrested or detained? Someone call. I don't know. Right now, just on the phone. Oh, now I'm reporting.
I'm reporting too. Yeah.
Kids are here.
This makes no sense.
That don't make no sense. They don't let us out much.
When you see a crowd, when you see a line that's not distanced, when you see a supermarket that's too crowded, anything, you can report it right away so we can get help there to fix the problem.
Gretchen Whitmer has spent most of her working life in the grubby, small-bore confines of Michigan state politics. That is not a training ground for excellence. So when she was elected governor a little over a year and a half ago, nobody expected that Whitmer would suddenly morph into a wise and inspired chief executive. And indeed, she hasn't. When the coronavirus hit Michigan in force last month, Whitmer had no clue what to do. So she responded with a mixture of comical ineptitude and a weird kind of arbitrary fascism. She banned the sale of carpets and paint and potted plants. She told people they couldn't fish or go to church or drive alone to their own homes. But at the same time, Whitmer kept liquor stores, weed shops, and lotto kiosks open because, and this was purely an epidemiological matter in the interest of the public health, those were essential services, quote.
Yeah, it's Sunday, and the Brighton police are apparently arresting a dad for throwing a ball to his daughter in complete isolation in a park of about, I don't know, 30, 40 acres. But apparently that is not allowed by Brighton. According to our police, he's not allowed to do it. He's being taken away.
They don't let us out much. That don't make no sense. They don't let us out much. They don't let us out much.
Yeah, Jessica, the doctors say that they have compiled their own data of coronavirus cases here in Kern County and used their research from the cases here to cross-reference them with numbers across the nation and really across the globe. They say that that data shows that healthy people don't need to shelter in place anymore. And of course, that's going against what a lot of health experts have been telling us so far.
I say, do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no. Do we need to test them and get them back to work? Yes, we do.
Doctors Dan Erickson and Artin Masihi, both co-owners of the 5 accelerated urgent care facilities in Kern County, say they have tested 5,213 patients within the county for the coronavirus. That makes up for over half of all testing done here. They say their data and research qualifies their statement.
Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rate. So we are saying that our response now that we know the facts, it's time to get back to work.
The White House Coronavirus Task Force expert Dr. Anthony Fauci says otherwise, with national research showing COVID-19 cases to be over 10 times as lethal than the flu. But Fauci's decades of experience as an immunologist and physician holds no weight in the eyes of Erickson and Masihi.
We're actually seeing the patients. Dr. Fauci hasn't seen a patient for 20 years.
White House health officials have reported more than 800,000 COVID-19 cases with just over 46,000 deaths across the nation. But Erickson says that quarantining is a health hazard in and of itself.
We understand microbiology, we understand immunology, and we want strong immune systems. I don't want to hide in my home, develop a weak immune system, and then come out and get disease.
Reporting the disease, Erickson claims, is being forced onto healthcare professionals.
ER doctors now, my friends that I talk to say, it's interesting, when I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so.
According to Erickson, there is something much larger at play here.
This is not about science, and it's not even about COVID. When they use the word safe, if you listen to the word safe, that's about controlling you. So when I talk to all my ER doctors who work in a hospital, no stake in the game, same opinion.
And Erickson went on to say that the head of our public department here in Kern County agreed with him that we should be lifting stay-at-home orders. But when we reached out to the health department here, Michelle Corson, the spokeswoman, said that while Dr. Erickson and Matt Constantine, the director of public health, spoke to each other, Matt did not indicate that the state should reopen. For now, we're live outside of Southwest Bakersfield. Bayan Wang, 23 ABC, connecting you.
Why the hell wasn't I told about this? They don't let us out much.
We will not go quietly into the night. We will not vanish. We're going to live on. We're going to survive.
They don't let us out much. They don't let us out much.